The need for accelerated attention to be given to all persons living with albinism for the management and cure of health situations peculiar with the skin condition was highlighted at a recent press conference in Abuja. Our correspondent has the details. Worried about the plight of persons living with albinism in Nigeria on health issues, especially dermatological conditions, peculiar with absence of melanin pigmentation, the founder and chief executive of the Albino Foundation, Dr. Jake Epele, has called for a state of emergency on the healthcare provisions for persons with disabilities in Nigeria. Speaking at a press conference at the Foundation's headquarters in Abuja, Epele, who revealed that he is currently battling with 7 skin issues which are at the pre-cancer stages, stated that the essence of the conference was to sensitize the younger generation of albinos on the dangers of overexposure to the sun, while drawing the attention of healthcare providers on the need for proactive approach to the care of persons living with albinism and, in extension, the physically challenged persons in Nigeria.
Our members should be sun smart, stay away from the sun, 9 to 5 is the dead zone. Somebody will say, well, how can I survive without being under the sun? More advocacy is needed. I'm doing this not to show off what is happening to me. It's not palatable. It's a very difficult thing to do. It's important that we strengthen the advocacy. Every one of you here, one way or the other, have been fighting for this. I think it's time for federal government to pay more attention. They've paid attention, you understand, but I'm saying pay more attention to these issues. Over 2 to 3 million persons with albinism. I'm being conservative, you know. You can imagine if this happened to all of us at the same time. That will wipe out the entire society.
While lamenting the lack of adequate facilities in the country to cater for conditions peculiar with albinism in Nigeria, Jacob Epele called for urgent action by the federal government to expedite actions on policies on adequate provision of healthcare infrastructure in several centers across the country.
The federal government should set up an intervention fund. I think this is emergency. This is emergency. We still get reports that some of our members are looking for drugs. They can't give them the drugs that they require. And I can tell you, not because they don't want to, but because they don't have it. I witnessed that myself. They were looking for one of the requirements that they needed to give me in order to carry out the biopsy. And they didn't have it in the theater. How much is it? 2,000 naira. I had to go outside to buy it. The National Health Insurance Scheme had started a process of trying to work with the foundation so that they can work with persons with albinism. It was dropped. That idea have not seen the light of the day. One of their concerns is that they have not started covering cancer. You know, and in fairness to them, all over the world, there are very few government organs that covers cancer, which is not tenable. You know, cancer is a disease that must be fought by all. If a government is refusing to fund cancer through national health insurance, then who will fund it? It's something that should be done. It's an advocacy that we must also take to the next level. Also, it's important to call on the international community to come to our aid, you know. Thank God for what the European Union is doing with us. Other organizations, other delegations, other international partners should just get involved with something about persons with albinism so that they will have a future and a hope that people around them care.